Welcome back to Africa 54. It's time for our Africa Health Network report, and joining us now is Africa 54 Health correspondent Lino Mudu with some new information on diabetes. Hello, Lino.
Hello, Vincent. Hello, everyone. A study published in the World Diabetes Atlas says that more than 80% of the people living with diabetes in Sub-Saharan Africa are unaware that they have the disease. The report states that diabetes is a global burden as the number of people living with the disease continues to rise. But it says the situation is worse in Sub-Saharan Africa. The World Diabetes Atlas study adds that people between 40 and 59 are affected the most. And health and well-being company Royal Philips wrapped up its annual Pan-African Roadshow today. The 2013 Cape Town to Cairo Roadshow kicked on May 14th and ended today in Algeria. Now, in its fourth edition, the Roadshow aims to deliver equipment and resources to communities and health facilities. It has raised awareness on sustainable healthcare and lighting solutions, providing innovation in the areas of healthcare, consumer lifestyle, and lighting. The program has also offered clinical education and training programs for healthcare professionals, among other things. Now joining us via Skype from Amsterdam in the Netherlands to tell us more is JJ Van Donnen, Senior Vice President and Market Leader with Philips Africa. He's also CEO of Philips South Africa. Mr. Van Donnen, welcome to Africa 54.
Thank you.
Now, the Roadshow has been on, this is the fourth edition of the Roadshow. Can you tell us what was significant this year?
I think it's been ongoing in terms of the emphasis that we've had in terms of mother and child mortality. And what we are starting to see is the impacts that many governments are actually focusing on this area. And it was quite exciting to see the developments over the last 4 years, and specifically this year, we see further and further improvements in that regard.
Now, when you look at the type of impact on the ground, what can you tell us specifically?
What we're seeing is part of the roadshow is about dialogue and discussions with various ministries of health and major players on the ground. So whether it was in South Africa with, for example, the University of Tygerberg or the University of Johannesburg, or whether it was in Kenya or Uganda, all those various places we are seeing more and more focus in terms of trying to achieve the Millennium Development Goals. As you may know, Africa has an undue proportion of mother and child mortality. I think 50% of the mother and child mortality is occurring in Sub-Saharan Africa. It's about 4 million children a year under the age of 5, and about 350,000 mothers a year in Sub-Saharan Africa die due to complications. So what we are seeing is many of the governments are focusing in terms of trying to make impacts on this. So we see in countries like Uganda, Imaging the World, also working with the governments there in terms of impacts on how to pre-scan with ultrasound and detect complications. We had similar programs in Kenya, where we're working with Matari North Clinic in a more underdeveloped area, where we are working with them on scanning programs to impact and detect complications in childbirth.
Okay, now this year you visited 15 countries. How do you choose a country to be part of the program? Quickly.
Well, we've been ongoing. So we cover many countries which we have a strong presence in. Also countries where specifically the government has asked us to actually join them and join hands with them in terms of impacting. So it has included many Southern Africa countries, Kenya, Uganda, Ethiopia, Nigeria, Ghana, many of the traditional countries as well that are there.
Okay, finally, what's ahead? Quickly in 10 seconds. What's ahead for the roadshow?
Sorry,
What's ahead for the roadshow?
Oh, what's ahead for the roadshow? We are ongoing. We hope to see further strengthening of that. We are seeing more and more interest in terms of discussions with various ministries of health, where they are reaching out to a company like Philips to join them in terms of addressing their healthcare needs. So we see that as really quite exciting.
Okay, Mr. Van Donnen, thank you so much for joining us today.
Thank you.
And that was Mr. Van Donnen, JJ. He's Senior Vice President and Market Leader with Philips Africa. That's our Africa Health Network report for today. For more news and development, be sure to visit our website, africahealthnetwork.com.